here we are in another part that we're going to do is the aspiration of the adipose stem cells. So first, as any other procedure, we clean the area with antiseptic. This is the we call PRP. It's the combination of chloroxidine and alcohol, and these will kill all the germs. We're going to apply local anesthesia. So we're going to use lidocaine. Lidocaine is 1%. So basically the anesthesia numb the skin in order to perform a small incision to numb the area. All right, so once we have the the area, we're going to numb the skin with, again, a small tiny anesthesia, all right? So we pinch, again, your belly, but you're not gonna feel so much because they already put the spinal tap, okay? Do you feel that or no?
Just a poke.
Poke, okay. We're going to apply the infiltrator. The infiltrator is a special cannula. These products from the company from Tulip. It's a special cannula that it helps to introduce we call the Thomason's Klein solutions to numb the abdomen. So these holes help me to introduce the anesthesia. And once we introduce the anesthesia, we're going to numb the skin. So as you see, this is the special cannula. So this cannula will go through the abdomen. Okay, Abdul, so we're going to feel, you're going to feel a little bit something there. Go in. Ya lo puedes abrir. All right, so right now, this is the process that we call the tumescence anesthesia. This technique is being a procedure for liposuction since more than 70 years ago. Doctors from Italy and France developed this technique for liposuction. But well, in this case, we're not exactly a total liposuction. It's a process that we're going to aspirate the fat to culture the stem cells from the fat. So, but right now the goal is to introduce this solution that has the combination of some drugs to numb, which is the epinephrine, lidocaine, which is anesthetic, and the epinephrine is to numb the skin and also avoid the bleeding that we call vasoconstriction of the vessels, do not bleed so much. And then we're going to, once we numb the area, we're going to proceed to aspirate the fat. The patients feel less discomfort and less pain. Very good. How you feel, Abdul?
So far, so good.
Excellent.
No pain.
Good, I like that. So as you see, we already make we call tunnels to introduce this solution in the abdomen to infiltrate and give medicines to numb the skin. So we go from left to side, which basically this tumescence technique is numb and put very firm the abdomen in order to get the access from the fat.
You harvest fat.
Exactly. So, but right now the first part is to numb the skin and infiltrating with saline solution with the chemicals that I already explained. We're gonna close and we're going to go to the right side because we already numbed the left side of the abdomen. And we're going to the opposite, to the right side. So once we go there, okay, ábrele, open it. All right, so we are in the right side of the patient. So we're going to introduce more anesthesia that we call Klein solution. Actually, Dr. Klein is in California. This doctor, it's a dermatologist, surgeon. They invent this technique. And worldwide, doctor surgeons, they're coming worldwide to learn from him. He has also a PhD from pharmacology, and that's the way he learned how to do this technique. It's so nice to invent a procedure. There are a lot of doctors follow this technique. And right now the beauty is, with the new generation of procedures, the doctors can perform these when patient is awake. And we only numb the skin where we need to do the liposuction. All right, so as you see, we're done with the infiltration. Okay, so right now, as you see, this is a special cannula invented by this company that has the same technique to aspirate with pressure. So this company, Tulip, this size is 2.1 millimeters, very small cannula, harvesting cannula to harvest the stem cells from fat. This is the technique for aspiration. So once we introduce, I'm going to aspirate and we're going to harvest the fat. So once we introduce the cannula, right now I'm going to aspirate, and we're going to aspirate the fat. Any pain, any discomfort, Abdul?
No.
Feel good?
Professional.
Okay, I think it's a combination of the team that the anesthesiologist performed the blockage, and then is the whole process. So once we reach the goal of the fat by 5 or 6 cc's, and it's already full, the syringe, we're going to make another aspiration. You see? It's another way that still make vacuum the aspiration. So you see, guys, this is the fat is coming much better. The color, when you see it's orange color, is the fat.
About 1 centimeter less.
1 centimeter for numb, or you mean the incision?
Mm-hmm.
No, it's you're 2 tiny millimeters.
Oh.
No, just we put a bandage and that's it.
No sewing.
No. It's a non-invasive, not so bad procedure that you feel confidence that you're gonna be able to walk and all that. Any problems, Abdul?
Absolutely nothing.
I like that words when you say no problem. So the beauty of regenerative medicine is most of the procedures state of the art with the new techniques. Patients, we can do it in the office with local anesthesia. But of course, you need to receive a training for 3 to 4 years. Once you get the license to do this, you feel a lot of confidence to do it. And the patients, of course, always, you guys need to ask the doctors where they've been training. So it's very good to ask the doctors the diplomas and all the courses, because it's very important. Got it. So we're done. And this is the last from 4 syringes of 20 cc's, so we already draw 80 cc's of fat. Okay, so here we are again. So we're going to, the last step for the culture of the adipose stem cells, we're going to transfer the product from fat in a special device from this technique. We're going to transfer from one syringe to another, and that syringe is specific for this equipment. This equipment we call harvest terumo, in order to collect the adipose stem cells and culture. It only takes 4 minutes, and this will be like this. It's very simple. So from this, when you see is the process, these are a fluid and are the fats. So we want to just get these fat. So we're going to transfer this, and we want this, the fat. So this is only fat. The plastic surgeons, they do this procedure, and basically we want to do is transfer from one syringe, and this syringe is the special one with the special filter. This special filter is going to be in this. So you're going to see how we're going to transfer like this. We're going to transfer fat. Okay, so you see fat, but we have more. So we're going to withdraw the fluid, and again we're going to put more fat. It's more fat, okay? This is the beautiful fat that we collect, 25, 26 ml fat. You see, Dr. Polo? So this is the fat, and we're gonna collect in a special device, Smart Prep, Adipose. You see the adapter? So this needs to go here, and we place it in the centrifuge, and the balance to give you the balance. You see, has the balance of the same size of the other system. And we're going to collect the white dots needs to be aligned. Once we have it, and we put here, if you see, is Adipose. This is the button, and it's gonna work in 4 minutes. No noise, very smooth equipment, and it's going to culture the mesenchymal stem cells. So once we're finished, we can proceed with the bone marrow. So we'll be back in a moment.